I want you to take us right into the new uncertainties over these new projections that the death rate is going to keep going straight up.
Well, you're absolutely right. There is huge uncertainty that surrounds this unfolding pandemic and how best to control it. These new models tell us information that we should pay attention to. Models, however, are simply that. They are models of different possible futures that depend on the assumptions that went into the models, what factors you choose to emphasize, and how much weight you put on them. But it certainly gives pause when you look at the escalation in numbers, and clearly the escalation when you think about the relaxation of some of the social distancing that's going on. To me, it reinforces the message that we should not only pay attention to the models, but we should look at the data that we have at hand. And we do know that there are certain criteria that should create the framework for decision making about whether we're ready to sort of begin to go back towards whatever the new normal will be. And that is very important. What is the rate of new cases? Is it coming down in your area? And the rate of new hospitalizations? Are your hospitals operating at full capacity? Or do you have some play in the system so that if you have more cases, you can manage them? Do you have adequate testing to be able to identify not only those who are clearly showing symptoms, but also looking at what are the rates in the community of as yet unrecognized spread of this virus, and importantly, in certain congregate settings like nursing homes or meatpacking plants, where we know that the risks of an intense explosion of new cases can occur rapidly and very seriously. And then do you have the public health infrastructure to track and trace those who are infected, make sure they're isolated, and those who've been exposed that need to be quarantined while you determine if they're in fact going to get sick?